Great. We are now recording. Again, thank you all for being here for this week's Holler from the Hollers. My name is Quentin King. I'm a government affairs specialist at Appalachian Voices. Um, we started this series because we recognize there's a lot happening at the federal government level. It can be really hard to keep track of all of those things and even harder to know where to plug in, where to get involved, and how to advocate for your community. So to address that and help folks, we started this series that allows people to make calls to their lawmakers on issues that are of extreme importance. And right now, the Department of Government Efficiency, led by Elon Musk, have been cutting agencies and staff and programs and funding opportunities left and right over the last 2 months. While everyone agrees that the federal government could use some efficiency improvements, they're getting a lot of things wrong, and they seem to not be making or even acknowledging those mistakes and fixing them. At the same time, Congress is working on multiple packages that would fund the federal government and make sweeping changes to energy and tax policies and other programs that we think are really important for Appalachia and the country as a whole. So that's to say there's a lot going on, and we know one of the most effective things people can do is simply call their members of Congress to tell them what they're concerned about right now. And if we're all calling about the same things, we're making a bigger impact. So each week over the last 6 or 7 weeks, we've chosen something specific for people to learn more about and make calls to their lawmakers. It's every Thursday at noon. And we also stream this to Facebook, and we share a toolkit with resources, more information, and phone numbers and email addresses for lawmakers with people as well, so they can call on their own time or tweet on their own time or what have you. This one is a little different this week because we have two guests who are affiliated with the program that is the subject for today's Holler. And that is NIOSH and the Co-workers Health Surveillance Program. So this last week, there were some serious cuts to both NIOSH and the Co-workers Health Surveillance Program in West Virginia that are going to put coal miners at risk. And this is just a continuation of cuts that threaten coal miners and coal mining communities. MSHA has recently had offices terminated and staff terminated. And now the silica rule has been paused for at least the next 4 months. That was protect coal miners from black lung disease. So this has been a coordinated attack on coal miner safety. So right now, I'm going to hand it over to Anita, who's going to talk with us and give us some background about the problem.
Okay, thanks to Quentin and everyone at the Appalachian Voices for inviting me here today and for your help that you've been giving us to get the word out about what's going on at NIOSH Morgantown in particular, but also at NIOSH facilities nationwide. As Quentin said, my name is Anita Wolf, and I was a public health analyst and coordinator of the NIOSH Co-workers Health Surveillance Program for about 20 years. I retired from 40 years of federal service in 2020, but my heart and soul is still with that program and the coal miners that we served. I'm going to back up just a little and say that NIOSH is the only dedicated federal research agency charged with preventing work-related illnesses and injuries for the 170 million workers in the United States. I worked in the Respiratory Health Division of NIOSH in Morgantown, and that is where the CWHSP, or the Co-workers Health Surveillance Program, is located. Many of the miners refer to that program simply as the NIOSH X-ray program. The CWHSP was created as part of the Federal Coal Mine Health and Safety Act of 1969. It provides free lung health screenings for coal miners, which includes a chest X-ray and spirometry or breathing test. This testing can determine whether a coal miner may have lung disease, such as black lung or silicosis. These diseases are progressive and are caused by inhaling too much dust in the coal mining work environment. Screenings like ours can help identify problems early, and coal miners can then consult with their personal physicians for treatment and guidance to keep the disease from progressing to progressive massive fibrosis. The results of the screening are confidential and are sent only to the miners. Nothing goes to the coal company or to their employer. More than 300,000 coal miners have received these free to them screenings from NIOSH since the program's creation. Coal miners typically work long hours, like 12, 14 days a week, sometimes 6 to 7 hours a day, sometimes 6 to 7 days per week. So it can be hard for them to go to a doctor on their own. And sometimes clinics that we have certified as NIOSH X-ray or NIOSH barometry clinics are not really close or are not easily accessible to the miners. So to address the raise in cases that we were seeing of black lung, as well as to make participation in the program more convenient for the miners, we also got and operated our own mobile clinic. Data through the CWHSP is also used to identify trends in disease. Black lung has been trending upward since about 1999. And currently, for Central Appalachian coal miners that have worked in mining for 25 or more years, 1 in 5 of them have black lung. The CWHSP also houses the NIOSH B-Reader program, in which physicians are trained to interpret chest x-rays for occupational lung disease. They become certified as a B-Reader if they are successful when taking the NIOSH B-Reader examination. Besides the CWHSP, there are several other mandated programs that require interpretations by a B-Reader. This program will be gone. Another important component of the CWHSP is the Part 90 designation for miners. We at the CWHSP are the only entity that can designate a coal miner as a Part 90 miner. If the miner has any X-ray or spirometric evidence of disease based on the NIOSH screening, they will receive a separate letter telling them that they qualify for Part 90 transfer. If the miner decides to exercise the Part 90 transfer, the coal operator, by law, must transfer that coal miner to a less dusty area in the mine or bring them to the outside to work. This is so the disease does not continue to progress. This transfer is also to be with no loss of pay and or harassment. So what's the risk now? The President's executive order instructing Elon Musk's Department of Government Efficiency to eliminate waste in the government has taken an axe rather than a scalpel to many important programs that affect our health, water, air, worker safety, and more. Last month, approximately 30 MSHA office leases across the country were rescinded, as well as job offers to 90 mine inspectors tasked with keeping the miners safe. On March 27th, a notice of intent to conduct a reduction in force was emailed to every NIOSH Morgantown employee. And on April 1st, approximately 200 NIOSH Morgantown staff received emails that they were being essentially fired. The notification stated, and I quote, "This is necessary in order to improve the efficiency and effectiveness of the Department of Health and Human Services and to make America healthier." Really. They were further told that their duties were either not necessary or were virtually identical to duties being performed elsewhere. That is 100% not true. April 5, as most of us remember, was the 15th anniversary of the Upper Big Branch coal dust explosion, in which 29 miners died and 2 more were injured. Not enough lung tissue was found to be able to analyze all 29 of the miners. However, of the 24 that could be analyzed, 17 had black lung. Some of these miners that had black lung were as young as 25 years of age, and 5 of them had less than 10 years of coal mining tenure. On Tuesday of this week, several executive orders pertaining to coal were signed by the President. In his remarks, he stated that now the coal industry could flourish. But will it really? More coal may be able to be produced, but at what cost? If the people mandated to keep the miners safe and healthy are no longer permitted to do the jobs they were so dedicated to. With the recent cuts in MSHA inspector personnel, and the virtual complete dismantling of not only NIOSH Morgantown, but also NIOSH research in Pittsburgh, Spokane, Denver, and Cincinnati, that we were provided vast amounts of research on all kinds of other occupations, and our headquarters in Washington, D.C., and at the CDC in Atlanta, I truly fear we have another UBB in the making. Members of Congress need to hear from each and every one of you. Tell them that you don't want health services being cut for coal miners across the country. Any cuts in staffer funding for the CWHSP sacrifices coal miners' rights to health and threatens their families' well-being. One last thing I want you to think about. Many of the programs that have been cut in NIOSH were mandated by an act of Congress. The CWHSP is a mandated program. The fact that the executive branch is usurping control of Congress's intent. Congress has agreed to continue this funding for decades, up to and including a few weeks ago when they approved the continuing resolution. However, the executive branch has decided that what Congress wants isn't what they're going to do, and Congress needs to stand by what they agreed to do with these mandated programs. I want to thank everybody for their time today, and please reach out to your congressmen and women and ask them to preserve NIOSH.
Thank you, Anita. And before we give space for you all to call your lawmakers, I just wanted to ask if Noemi wants to say any words as well, but no pressure.
Yeah, well, I just wanted to say that what Anita said is a fantastic description of the work that we have been doing with the CWHSP. And I did overlap with Anita a bit. I joined NIOSH Morgantown in 2018, working as a research epidemiologist. And my focus was to use the information that came through the Coal Workers Health Surveillance Program to estimate prevalence of disease here in the US. And what we have seen is, just as Anita described, the prevalence of disease is especially high in Central Appalachia. And that's the states of West Virginia, Virginia, and Kentucky. And the reason why I wanted to come to NIOSH is because I have roots here in West Virginia, and I saw the good work that NIOSH does protecting coal miners and the passion that my colleagues have, they still have for this work. And I wanted to be able to come here and make a difference and help coal miners stay protected and prevent disease, prevent black lung, the most severe form of black lung, progressive massive fibrosis. And we've seen, just as Anita said, that for those long tenured working coal miners, and when I say working coal miners, I mean guys that are underground right now who have evidence of black lung. And it's about, right now in Central Appalachia, for long tenured working coal miners, about 4% have that progressive massive fibrosis and are still working. And so this program, the Coal Workers Health Surveillance Program, was meant to provide them a way to protect themselves. And if they can exercise their Part 90 right, which Anita described, to transfer it to a less dusty job in the mine, they could prevent further progression of disease and maintain their same rate of pay. And I just can't understand why they would want to remove this program and remove the right of miners to protect their respiratory health and to prevent progression to severe disease. And, all I really want to do is get back to work. Part of what I did with CWHSP, like I said, was analyzing the data, creating reports showing just how bad the issues were, and providing the research and proof showing that respirable crystalline silica is a big driver of this increase of black lung, especially in Central Appalachia. And a lot of that research is what went into writing the latest silica rule by MSHA. And it's the work that NIOSH does that tries to protect coal miners and ensure that they are not exposed to excessive amounts of this toxic silica dust in the mines. And yeah, I just really want to be able to go back to doing that. And I also spent time going out with the mobile unit and uh, providing this service to the miners directly in their communities. Either, so there's a mobile examination unit that goes either to coal mine sites or to sites in coal mining communities, so that coal miners can easily access these services, these screenings, getting an X-ray, pulmonary function test at no cost to them. And I was able to travel to coal mines across the country, but I did primarily stay here in West Virginia and talk to coal miners about their symptoms and how they're feeling. And, I really want to make sure that these coal miners can still be protected and can still have these rights that they fought so hard for throughout the 1960s to get that 1969 Coal Mine Health and Safety Act passed. So I think that we need to keep our promise to coal miners to keep them safe.
Thank you both very much for talking about your experiences. And yeah, hopefully we can get Congress to change their mind. Or to get the administration to change its mind. I should mention that, pressure does work. Senator Capito has come out already and said that she wants to see the administration reverse the cuts at NIOSH. And so we need to get more lawmakers interested and more lawmakers to give comments like that and statements like that. So that being said, now's the time where we ask people on the call and on Facebook to contact your 2 senators and your Congress member. The Capitol switchboard, the number that you can call, there's several numbers, sorry. There's one that someone's going to put in the chat right now. And that's a Capitol switchboard number that can direct you to your representative. There's also in our toolkit, we have direct office numbers, we have email addresses and contact forms and social media handles for Central Appalachian lawmakers. You can also find other lawmakers on their own websites outside of the region. So this script now that I'm putting up is just a sample script that you can use. You can reshape how you want. You can insert your own personal story about Black Lung or NIOSH into this. But for now, for the next, I think 8 minutes, I'm going to ask folks on the call to call your lawmakers. If you get any successes, anyone pick up, please feel free to type that in the chat or just tell us in general how it's going. So I will go on mute and let you all call. Thank you.